But if you're doing this at least once a week, or if you're doing it 3 times in a month, then you begin to fall into a category where you're exhibiting behaviors that can be defined as welcome back to the power of healthy habits on Amani Life, where small changes can lead to huge positive transformations in your lifestyle. I'm your host, Kareem, Black Man. What's up? Today I have an interesting topic which many of us can probably relate to or identify in society, and that topic is binge eating. Binge eating is something that commonly happens, especially if you're at an event or a holiday celebration, at a period of time where, it's jovial, nice foods are out, the desserts, and all the different types of foods that you don't normally eat on a regular basis are available. And sometimes we can overdo it. And oftentimes, if it's just on occasion, we can get by without an issue. But we know that there are more people that result to binge eating in an effort to get over a situation or a happenstance. And unfortunately, sometimes that transitions into a lifestyle habit. So first, I'd like to talk about what binge eating is defined as. We can identify it sometimes as, going to a birthday party, overeating on pizza, and we got so much pizza that we are just discomfort sets in, and you don't want to get up, unbuckle the pants to get yourself a little bit of relief. That's kind of a way of identifying perhaps when you've overeaten. But binge eating specifically has parameters to define it a bit more clearly. And binge eating can include a loss of control, feeling unable to stop eating or control what or how much you've eaten. It also includes a physical or emotional symptom that could be eating rapidly, eating until uncomfortable, eating until you're full or beyond full, and eating large amounts even when you're not even hungry. So just eating just to be eating. Sometimes people also resort to eating in secrecy. So you've eaten already, you've eaten with the family, or maybe you've eaten with your friends, you're eating at lunch, and then you go and sneak into the car, to the garage, into the basement, into your closet, and you're having more food to eat. Another thing is emotional distress or depression, feeling low or depressed. Some people resort to eating to get away from whatever else is going on in their lives. And doing this, not just one time, doing it once a year is a completely separate thing. But if you're doing this at least once a week, or if you're doing it 3 times in a month, then you begin to fall into a category where you're exhibiting behaviors that can be defined as binge eating. And the act of binge eating is something that could be developed if it's a learned behavior. Sometimes people aren't aware that they might be binge eating because they've seen it frequently in the household, or maybe even on television amongst friends, and it just becomes a habit that you're not even aware of that's taking place. So one of the first things that you would want to do is really identify and become aware of what your eating habits are and how they're impacting your lifestyle before it gets out of control. So now I'm going to share a little information about what the Mayo Clinic says about binge eating. Binge eating disorder is a serious condition. It always involves feeling like you're not able to stop eating. It also involves eating much larger than usual amounts of food. People who have binge eating disorder often feel embarrassed or ashamed about eating binges. People with this disorder often go through periods of trying to restrict or severely cut back on their eating as a result. But this instead may cause increases in urges to eat and lead to a cycle of ongoing binge eating. Treatment for binge eating disorder can help people feel more in control and balanced with their eating. If for any reason you feel like you may be on the verge of being one of these people, if you're binging weekly and it's not out of the scarcity of food, especially, I don't want anyone to feel as if, since they have food scarcity, and when they get into a situation where they can actually have food and they overeat, that they should feel ashamed of themselves because of that. That's a completely different scenario. Though it may still be binge eating, it's not exactly what I wanted to create this video for. This video is for those of us who are eating for the pleasure, for the luxury, and it's causing us to have poor lifestyles, impacts on our health. Of course, the people who are experiencing food scarcity need to be cared for as well, but their motives are completely different. The act of eating, perhaps because there's another underlying issue that is bringing you to cope with whatever the problem is through eating, is something that should be addressed, because we can go years without addressing unresolved trauma, and the self-medication that we go through is binge eating, which could lead to, depending on what you're eating, organ failure. It could lead to obesity. It could lead to just having an unhealthy lifestyle that could carry on through multiple generations. So you can pass these behaviors down to siblings, or to your offspring, or to anyone that you come in contact with, because sometimes people who binge eat use eating as a way to have fellowship with one another. And if we're consistently overeating for long periods of time, as mentioned, if you're binge eating once a week or more than 2 times in a month, then it's possible that you could have binge eating disorder. And being aware of that, I think, is the first place to begin. Of course, different times of the year, if you're a sports fanatic, things like that, you might have too many wings. Hopefully you're working that off and burning it off, and not specifically going to a new diet where you're changing your entire dietary intake for 2 months to get the weight off, but then you really haven't changed your behaviors. But being aware of what those symptoms are that I mentioned, and how they impact your behavior and the things that you do, is probably one of the best places to begin. And at some point in time, if you know that your eating habits are uncontrollable and you continuously are going through this cycle, then you may want to see a doctor. More information from the Mayo Clinic. If you have any symptoms of binge eating disorder, get medical help as soon as possible. Talk with your healthcare professional or a mental health professional about your symptoms and feelings. If you're embarrassed by your eating and are worried about talking to your healthcare professional, start by talking to someone you trust about what you're going through. Now, with sharing this information with a friend or family member or a teacher, definitely make sure, or try as best you can, that you can get confidentiality with these people if you feel like you want to share with someone. The likelihood that someone may not hold your sharing this information in confidence is relatively high, and if you think that could throw you into a further, perhaps if it's maybe depression or whatever it is that you're going through, then keep it to yourself until you can talk to perhaps a medical professional or someone that can help you bridge the gap from at least acknowledging what's going on and finding the best way to get treatment. Okay? Talking with a medical professional with a specialty in training for eating disorders, or reaching out to an organization specializing in eating disorders might be a good place to find support from someone who understands what you're going through. If, for example, you're at a point where you know you eat too much, maybe you haven't gotten to the point where you want to define it as eating disorder, please just make sure you're making note of what it is you're eating, how much you're eating, and then what is taking place that causes you to eat above and beyond proportion. Because sometimes changing your environment, changing your activities, changing the order in which you do things can impact whether or not you go over the top. Sometimes just eating what you need to have and stopping is easy to do. But then if you're watching a game and you get excited, you want to have more fries, that influences you to go above and beyond. Being aware of where you are and what causes it could help you prevent the issue without necessarily having to get treatment immediately. And then if you do need to get treatment, it's okay to know what's going on before you get to the point that you've overeaten or you've done it repeatedly in a pattern. So now you've identified, okay, this is what happens. I go tailgating and I'm only doing it from, let's say, August until December because that's football season. Well, at least you've identified where you may have a issue with your eating habits. And if we identify it, you can identify how you can come up with a solution so that you don't allow this to become a pattern of eating that could potentially consume or take over your life. Okay, now let's talk a little bit about getting help. Getting help for someone that you think may need help with binge eating disorder, or for yourself. You know, people who have this condition sometimes become experts at hiding this behavior. A lot of times because they're embarrassed or a little bit of ashamed of how much they're eating. Sometimes people who have this behavior let you know that they eat too much and that they need to make a change. They literally say it. I overdid it. I need to stop doing this. But the symptoms and the behavior of falling back into it kind of becomes addictive. And I talk a lot about being addicted to textures, being addicted to crunching, being addicted to just the act of chewing, and how sometimes you could be doing great, perfect, eating the portion sizes that are recommended, but then you have one thing that's not inside of the diet. Or, for example, you eat fruit and vegetables in the portion and size and quantity without a problem. Then you have French fries, and then you find yourself eating more fried foods or things that are not within the dietary plan, and you find yourself back into this routine. If you know someone, or if you yourself have this disorder, at least be aware that this is a sensitive topic, and I'm sharing this with you in confidence, or going to that person, letting them know that I'm not sure, but this could be a sensitive topic. I don't want to make you feel as if this is no small task or issue. This is something that could have grave consequences. So eating disorders are mental health conditions, and the behaviors are not the fault or choice of the person with this condition. Give encouragement and support. Offer your help. You can do this by offering the help to find a healthcare professional or a mental health professional, or you can go to the appointment with the individual once the appointment is made. These are just approaches that you can take to helping someone or helping yourself get the treatment that you may need.